The other news besides a pandemic, riots, vandalism, and looting yesterday was late in the afternoon, Lifespan and Care New England announced that they were entering into negotiations yet again. I was trying to count the number of failed merger discussions that have taken place between those two hospital groups over the last 20 years. It's at least a half dozen that we could identify. They were in serious negotiations in 2019. Brown had stepped forward with an offer of $100 million to underwrite it. Now, 9 months later or so, both hospital groups are severely economically damaged. Lifespan's losing on average this year around $30 million a month. Care New England, which is a much smaller hospital group, is losing around $20 million a month. Care New England's in a much weaker financial situation. Is this good news for Rhode Island, or is merging two very weak economic organizations kind of like buying Memorial Hospital?
I actually think it's good news for Rhode Island if the legislature figures out that it needs a hospital regulatory commission as well. So these two systems have always had great synergy and should have always been put together. I mean, the strength of Rhode Island medicine is the tunnel that connects Rhode Island Hospital to women and infants. On the clinical side, there have been great collaborations going back, as long as I can remember, and it's been a source of strength and should be a source of pride. That we let egos and economics get in the way of developing a great clinical enterprise, well, shame on us. On the other hand, when you combine hospitals, the evidence from around the country says over and over again that they use their monopoly power to push up healthcare costs, and that's the last thing we need. And the way you control that is to create a hospital regulatory commission and, frankly, set hospital pricing. If you keep the fee-for-service world, and the opportunity, the really big opportunity, is to dump fee-for-service altogether for most things, certainly for primary care and possibly for hospital care. The question is whether we are willing to think big enough and have the courage to change and really make ourselves a great hospital system as part of a great healthcare system that focuses on cost and outcome, not on reputations and egos.
Egos have dominated, and oftentimes you had CEOs at Lifespan who left on exit years with north of $20 million in total compensation, an unheard of amount in nonprofit world in most major cities, and here we are in a second tier, Providence, Rhode Island, and that type of exit and that kind of parachute was allowed to happen. That's repeated itself, maybe not to the same level of grandeur as George Vecchione's departure, but is there a worry that this was held up last time by egos? Is it such a desperate situation at Care New England that they've got to get a little more humbler and come to the table with a real opportunity to negotiate?
Respectfully, there's plenty of opportunity for humility all around. It's not in one or the other, I promise. Everybody has that opportunity. I've seen this, I've been part of it. We really need a true, the president wanted to inject disinfectants. I think if we injected humility all around and get everybody focused on cost and outcome and really have somebody willing to hold their feet to the fire, then we might make some progress. But this is not just about hospitals. This is about government and its willingness to do its job.
Dr. Fine, a final follow-up on this subject. Is there the political will, the political strength by the governor, by legislators, by the attorney general to come up with a regulatory structure that will be strong enough to control such a mammoth behemoth? Or does the mammoth behemoth, if a merger took place, control the state of Rhode Island?
Usually the latter. And that's the open question. This has always been about the weakness and porosity of government, not the strength of hospitals. The question is whether my colleagues in government have the backbone to stand up and do for Rhode Island what Rhode Island needs. We'll see.
We'll see. Dr. Michael Fine, thank you so much. As always, incredible insights. For everyone else, we'll be on shortly with John Marion from Common Cause talking about decisions over at the Ethics Commission and potential violations that are all revolving door to manipulate gaining a seat on the state Supreme Court by a state senator. More on that in just a few minutes. Everyone else, see you back shortly, and also check in on the governor's press conference at 2:30. Please, please stay safe.